So next station will be done by Dr. Ahmed. Are you there?
Yes, I am.
Tell me when you are ready.
I'm ready now.
Okay, you have 1 minute to read the station.
Okay. 45-year-old lady underwent laparotomy. She's currently in pain, heart rate 120. Her blood pressure is 140/100. You are a surgical senior house officer in the ward, and the nurse has asked you to review the management of this patient. Okay, blood pressure, heart rate. Okay, laparotomy. Okay.
Okay, Dr. Ahmed, what are the ways to assess pain?
Well, there's visual analog score and the verbal pain intensity score.
Anything else?
There's also the numeric scale from 0 to 10.
Okay. What is the pain pathway?
The pain pathway, it starts from the delta fibers, A delta fibers, and the C fibers, decussating the ventral horn of the spinothalamic tract, and then to the ventroposterolateral nucleus of the thalamus, reaching the internal capsule to the cortex.
Okay. How do you manage the pain, or how you manage this patient?
Well, for this patient, I will, regarding she has done laparotomy, I will order a weak opioid, either. Well, I will go with the non-steroidals and the paracetamol. Maybe occasional use of weak opioids in the first day.
Okay. Look to this chart. This is a chart for this patient. What do you see in this chart? And how you will manage what you will do after seeing this chart?
Okay. Well, I will, regarding this chart, I will check for the pain score to review the paracetamol dosage, and if I want to add anything else for the pain, I will also may add a codeine. For her pain, as the only paracetamol is not enough, and I will review her pain score and allergy.
What did you see from this chart? What this chart tells you?
Well, it shows me that the patient is having paracetamol for the pain only, and clarithromycin for her laparotomy to prevent any infection. And there's salbutamol, which is given when required. I think it says drugs for the pain is not enough, and I want to add another drug for the pain. I will review her pain and score, and I will give her something.
So, what's the mechanism between different painkillers? How the different painkillers works?
Well, painkiller of the non-steroidals is a cyclooxygenase enzyme inhibitor.
Mhm.
And the paracetamol also is not fully understood by in most theories. It's a cyclooxygenase enzyme COX-3 inhibitor. Also, the opioids act by binding to the mu receptors centrally and peripherally, such as the morphine. That's for the pain mechanism of the pain killer.
Why is codeine bad?
Well, because codeine is metabolized in the liver to morphine.
Mhm.
And this metabolization is done by the cyclo CP450 enzyme in the liver. And this enzyme is absent in certain populations. That's why it may not work.
What are the effects of pain on body, physiological effects?
Well, it differs according to the system. In the cardiovascular system, the pain causes increased heart rate and increase in blood pressure. In the respiratory system, it causes change in decrease in chest movements. In the GIT, it causes paralytic areas, and it may cause immobilization, which can cause DVT.
Mhm. What are the other modalities of analgesia, do you know?
Well, there's the epidural analgesia, and there's the nerve block, also the nerve block.
What else?
Well, that's the peripheral nerve block and the regional nerve block, the types of block, and the epidural analgesia.
What else?
No, I don't know.
Do you know patient-controlled anesthesia? Analgesia, sorry.
Oh, yes, the patient-controlled analgesia.
How does it
Yes,
work?
it works by an infusion pump that controlled by the patient, when which have to push the trigger when he feels pain, and this is controlled by the patient, but it has a one-way valve which prevents the backflow of the medications that may cause excessive medication given the next dose.
What are the safety features of patient-controlled analgesia?
It has a fixed dosage, and it has a valve which helps to control the dose of the analgesia.
What are the complications of patient-controlled analgesia?
It is battery operated. It can break down any time, and it is not applicable if the patient is not fully conscious.
What are the side effects of opioids?
Well, regarding opioids, it may cause respiratory depression, and it may cause nausea and vomiting and constipation.
How to manage nausea and vomiting?
Well, in opioids, it's called by central and peripheral mechanism. That's why we could prevent it by a combination of dopamine antagonist and serotonin receptor antagonist and H1 receptor antagonist.
Who to involve in the management of this patient?
In the management of this patient, the doctor, the nurse,
Which doctor and which nurse?
there's the ward nurse and the nurse aides and the nurse which and the doctor, the surgeon, and the follow-up registrar and the house officer.
Okay, Dr. Ahmed, you did well. You finished all questions in the time, exactly in 8 minutes, and this is good. But there is some questions you are not answered. correctly or fully. Now I will tell you the typical answers. Let's go through the station again with the typical answers for these questions.